Good morning, everybody. I'm really excited to be joining you guys and talking to you a little bit about resiliency and healthcare and why it matters to me and why it matters in general to kind of strengthen that resiliency muscle that I believe everybody has, but it just needs to be strengthened. So a little bit about me. I'm Teresa Nguyen. I was born and raised in Denver, Colorado. My pronouns are she, her, hers. And I have a professional background in public health. I received my master's in public health from the University of Colorado Anschutz Medical Campus with a focus in community and behavioral health in 2016. And at the same time, during those graduate studies, I was a LEND Public Health Fellow. And I decided to become a fellow because I knew that even with lived experience as a person with a disability, I needed to expand my knowledge and my perspectives around a variety of developmental disabilities. And so I'm glad to kind of be in the journey with you guys, or I'm glad to be in the journey with you all as previous LEND Fellows, as current LEND Fellows. But I think it's a really fantastic training program that sets you up for success in the career of working with families and people with disabilities. I currently work at the University of Colorado, Denver, as a curriculum developer. And I specifically develop trainings and technical assistance for the Colorado Office of Employment First, which is an office that is trying to shift the culture of employment and what that means in the state of Colorado. And so I am very honored to bring my health background into this work, because we all know that the employment systems and the health systems are, while they are separate, they intertwine very closely for somebody with a disability. And so it's very innovative work, and it's very exciting work that I'm thankful to be a part of. Lastly, I am a woman with lived experience as somebody with a disability. I was born with a genetic disorder called osteogenesis imperfecta, or OI for short. It causes my bones to be very brittle, and I use a power wheelchair to help me navigate my world. We're talking about resiliency today, so I wanted to define it in the way that it resonates with me and hopefully with you all as we continue this discussion. The Oxford Dictionary defines resiliency as the capacity to recover quickly from difficulties, toughness. They define it a second way as the ability of a substance or object to spring back into shape, elasticity. Of course, we are not going to be talking about a specific substance or object of any kind springing back into shape, but metaphorically, we will be talking about how we ourselves and our understanding of the world expands and springs back into shape after some challenging times and after some adversities. I want to talk a little bit about my story and the adversities that I've gone through, and how that's really shaped me in my career and my contributions to policy and programming in healthcare. Like I said, I grew up with a disability. I was born with one, and that may have been the easy part of my life. In addition to that, I am a first generation Vietnamese American woman. I was born to two immigrant parents from Vietnam who had immigrated here just a couple of months before I was born. And so right away, my parents were thrown into the deep end of first the American lifestyle, which they knew nothing about, and second, the American healthcare system, which I would like to say a lot of us know nothing about. And then add on top of that a language barrier that kind of made the process of obtaining services and supports for me very challenging. And so, as my parents navigated this healthcare and medical system for me, I was also learning about how to navigate that as a child. My learning curve of learning a language was much smaller than my parents. I learned English right after preschool. I was enrolled into preschool without any knowledge of English. That was an interesting time for me. But after completing preschool, I was pretty proficient and continued in public schooling all the way from K through 12. And so my English skills, of course, became better each year. And I want to say, beginning at 9 years old, I began really taking over the medical interpretation of my clinical appointments for my parents. And it was not to say that the medical interpreters that were provided to us were not competent or knowledgeable in their area of work, but it is another consideration to think about the familial structures that were in place between my parents and myself. Of course, we had a dynamic already set in place, and I was able to interpret that information in a way that made sense to our family and our needs at the time. And so I began doing that at a very early age. And because of that, I learned how to develop very independent skills as a child. I learned how to slowly navigate the medical system, the education system. Those were kind of the two systems that I interacted with the most when I was a kid. But I also learned about the Medicaid system and what in-home supports and services looked like for me. And I learned about eligibility at a young age to even qualify for Medicaid waiver programs and all sorts of things. And so, as you can imagine, it is not something to be taken lightly that a child has to not only deliver the information and the resources that are being talked about to their parents, but in my case, I also had to be a very active part in my medical decision making. In addition to my parents having a very strong language barrier, our values were very different. I was growing up in an American society where the message was to become as independent as possible and really take responsibility for your own life and goals. And my parents came from a very traditional Asian culture and value of kind of having a little bit more of that interdependency on each other. They were absolutely wishing for the least amount of independence possible for me so that they can take care of my every single need up until I don't know, I don't know when. But that was kind of their vision for me. And so I had to advocate for myself, not only in all of these systems that I interacted with, but I had to advocate for myself in my own life. with my parents because of our very strong values that sometimes differed. And so, with all that to say, that is a very, very different experience than the average 9-year-old child. I'm sure you all know that. But that was a very challenging time for me, and the navigation and the time management, the decision-making skills and learning, of course, is ongoing and expands as you get older. And so all of those skills, while they were building me up to be a very independent adult, really got in the way of me being able to enjoy very simple things like friendships and like sleepovers and movie nights with your friends. And so I just wanted to give that background to kind of continue the conversation of this path to resiliency for me. Of course, now I'm an adult, and those experiences have shaped me for the better. I am very independent in my own life. I love to travel, as you can see here. I love the outdoors, probably even more now because we have this bigger need to unplug and to get away from the world of email and internet and cell phones. And so I love the outdoors and love being in nature. But I live on my own. I am able to drive. I also, like I said, work, travel independently, and I really have a full life. And part of that has led to kind of this big goal of mine to use all of my experiences that I've gone through to try to shape the policies and programs who serve people with disabilities into something better. We all very much know how fragmented each system is, how fragmented the policies are for different groups of people. And so I knew that I could use these experiences for the better and contribute to my cultural competence in the area of policy and programming. So cultural competence is defined as the ability of providers and organizations to effectively deliver healthcare services that meet the social, cultural, and linguistic needs of patients. This is, of course, a very health-focused definition of cultural competence taken from Georgetown. But it really is, I think that oftentimes when we think about cultural competence, I know that the first thing that comes to my mind is how do we incorporate a diverse workforce of racially and ethnically diverse individuals. I don't necessarily think that that is the limit of cultural competence. I don't believe that you have to be diverse to be able to have cultural competence. You just need to have the social, cultural, and linguistic kind of context and relevance and understanding in your life to be able to serve your patients and your families that you work with. And so I believe that a lot of my experiences have contributed to my cultural competence and resiliency in my work. When I was entering adulthood, one of the biggest barriers to this process for me was just the very fragmented system of healthcare transition and what that meant. As somebody with multiple health issues, it was very hard for me to find primary care providers and specialists and therapists that were willing to take me on as an adult patient in the adult healthcare system. A lot of this was due to the provider's fears of not understanding and not knowing enough about my medical complexities to take me on. A lot of it was due to, as I later have learned, due to training and the lack of training that providers receive. There were a lot of reasons why transition was very rocky for me. And because I had witnessed that firsthand, and because I had a very strong provider who advocated for me, I was able to start learning about the transition system and the medical system from a professional standpoint. And I decided I wanted to change it in some way. I didn't know how I was going to do it. I didn't know how I was going to change the healthcare system for these adolescents who were facing the same issues as me in moving over to an adult healthcare system, but I knew I wanted to try, and I knew that I had the skills already of advocacy and decision making to create a change. And so I became very active in the state of Colorado and their medical home initiatives. I became very active on the national level with the GOT Transition, National Transition Care Initiative, and finally helped develop some processes and some documents and some evidence-based kind of practices for health clinics across the United States to be able to be more seamless in the way that they transition their patients into adult care. And so I believe that change and that you'll probably learn at some point in your training about the 6 core elements of transition from gottransition.org. And that process was, of course, I assisted with developing that process. I also assisted with some of the tools and the needs assessments that are available to providers to be able to start the transition process for their adolescent patients with disabilities. But I believe that none of that could have happened. I could not have been a part of that process and that change in the system unless I used my challenging experiences to inform those practices that are out on the interwebs now. And so I think that, I found a way to kind of use these challenging moments to kind of strengthen that resiliency muscle, right? To recover from the difficulties and the challenging moments of adversity in my life. I have also been a part of, as a staff member of our state healthcare policy and financing program. I have been on a team that's moved legislation forward for the state on expanding transition services for the state of Colorado. I've been a part of the language changes within the waiver policies and amendments that we've put forward in the state. And so again, I believe that my lived experience has really contributed to those small but big changes in our state policies and programs. Of course, the professional background of mine is helpful in terms of my education and my graduate level education, but it's really understanding exactly what families and what patients with disabilities go through from a personal lens that really has helped me put that into writing and put that into action items for policymakers to address. So that's kind of my life story and how I have learned to build that resiliency muscle of mine. But I also did want to talk about a healthcare provider who I am very blessed to witness firsthand his journey of resiliency and how he's really shaped that into cultural competence. You'll see the picture on the bottom right-hand corner. That's me and my very long-time orthopedic surgeon from my childhood. He is now retired and we are very great friends. But my family, my parents, began this journey with this man when I was about 1 year old. And this is a lot of course, I don't remember when I was 1 year old, but a lot of what folks recall back to me and a lot of what this doctor has shared with me was there was a lot of fear and worry coming from my parents throughout my childhood. And that really was clear in our medical appointments. I shared earlier that I have and had this very strong goal of being an independent person, doing things on my own and, having that goal of just living life, just like every other 30-something-year-old. And as a child, I made that very clear, I think, at home. And my parents did not know how to help me. Peer mentors with disabilities were very far and few back in the day. I still think there's a shortage of peer mentors now, but there was even a bigger shortage back when I was a child in the 90s. And so my parents didn't really know how to help me first navigate that goal of independence, but they also didn't really know how to react to that. Their values are very different. They expect to take care of all of their kids, disability or not, well into adulthood. And with kids with disabilities, it's expected that they're taken care of by their families, by their parents for their entire lifespan. And so this goal of mine really didn't make sense to them. And they shared with my orthopedic surgeon a lot of some of the worries of, how is my medical treatment going to contribute to me being independent, and a lot of other worries that I can't recall right now. And I think a lot of the time my provider picked up on that too, even if they did not communicate that in the right way, and the worry and the challenge. And he decided this was going to be a process where he had to really try to build some trust in my parents before giving them guidance on how to raise a kid with a disability who wanted to become independent. And he just really embraced his Chinese American upbringing and often talked about the similarities between my parents and his parents, and then his similarities between he and I. And he somehow was able to help my parents over the course of many years understand that a part of their fear is because of the cultural barrier that they are not comfortable with in America. And then a lot of their fear is because they have not been exposed to independent adults with disabilities. And he helped bridge that fear and kind of close that gap between their knowledge of disability by slowly introducing us to other families with older children with disabilities. He introduced us to his family, his mom, who very much aligned with how my parents behaved and what they believed in. They were very aligned in that. And my parents began to understand that independence is highly embraced in the American culture, but it also is possible for people with disabilities because of the services and supports that this country is able to provide. They don't have the same supports and services in Vietnam. And so they truly did not know if it was going to be possible for their kid to live this life that she had dreamed up. And so he did a lot of work to build that trust in my parents and then slowly kind of guided them into this independence process. And I believe he went through some adversities and challenges of integrating into the American culture himself. And he used those very challenging experiences to contribute to the positive health outcome of his patients. And so why does this matter? It matters because various public health studies have shown that mutual trust is essential to the patient-provider relationship in the achievement of positive health outcomes. I share my health provider story because I know that many of you are probably training to be a health provider, or you already are a health provider. And that category of health provider in my mind is very broad. It extends beyond a doctor. It is a therapist, it is a social worker, it is a psychologist, psychiatrist, it is a direct care worker. But as a health provider, I think you can add to your cultural competence knowledge of your families and your patients just by thinking about some of the adversities that you have gone through in life or that you have gone through in your career. And it matters, resiliency matters because lived experiences add value and quality to the services and programs that serve families and people with disabilities. As I've shared, I don't believe that I could be as effective in my role as a policy liaison or as a curriculum developer or as a program officer at the federal level. I could not be effective in my role in these professional careers if it was not for my lived experiences and my own experiences of adversity. I think that oftentimes we have folks who are higher up in the policy level or higher up in the program development level of careers, and they often are very disconnected from the community, from the families and the people that they serve. And so they're not often asked to think about what personal experiences have driven you to want to make a change for this community. And so I ask you to, as we move into breakout sessions and discussions, I want to ask you to think about the stories and the circumstances that your families and your patients go through. And are they relatable to something that has happened in your own life or something that has happened in your career path? And how will you use those own adversity experiences to inform your practices and your work? Challenging times and adversities are very stressful and they are very overwhelming. And oftentimes when you are in the moment of them, it is hard to think about how to use those experiences to help inform something bigger. But I believe that every failure, every challenge, every hardship can be made into something good and can be used to even connect with a family and or a patient. That connection can determine a lot of what your outcomes will be when you are working with the community. And so that is all I have for you today. I'm excited to take your questions, but I've left my contact information here and my Instagram handle. I always think that it's better to go and see for yourself how people with disabilities live their lives instead of just hearing somebody talk about it. And so you can see a lot of that documented in my Instagram.